All right, Megan, thanks so much. Well, we are now going to be talking about your pet and your pet's heart. And with us today is Dr. Jerome Williams, along with Dr. Ingrid Straeter. Good to see you both.
Good to be here.
And Dr. Straeter, you brought a friend.
This is Sam.
We're going to see these guys. There they are.
Yes, he's a rambunctious 2-year-old. He's wonderful. He's one of my rescues. Can you lift up your head, honey?
We'll get a shot of it. Just hang on. So talk about this. And
so he is a larger breed dog, which is why I took him. He's a boxer mix, actually. And I'm talking today about a heart muscle disease, which is called dilated cardiomyopathy. And these dogs
is it common?
It is fairly common, and it's very difficult to diagnose unless you have an echocardiogram, because very often the first signs are subtle, which is really when you want to discover it,
What would
not
a sign
later
be,
on.
for example?
Honestly, you often don't even have a heart murmur. The best thing would be to screen them when they're certain ages.
Is the dog showing some signs of something, though, before?
Probably not. If
Really?
they do, then it's already more advanced, and I would love to see them earlier than that.
Okay.
So there's some things you could do if you're able to diagnose so much earlier?
Yes, so we do have medications for that, and usually the earlier that you discover it, the better it would be. And so it's hard to tell everybody just go and screen your dog, but it might be better for them.
You sent us a couple of pictures, and this is an echocardiogram,
That is
just like we have as humans, right?
Yes,
Okay.
same thing.
Let's look at those.
So we have a heart here that is so-called long axis view, and it's labeled for the AO aorta, LV is left ventricle, and then LA is the left atrium. And I'm looking especially at how big is the left ventricle, LV, and how big on this chart here is the wall. If you see the next one.
The dark area is the wall.
Actually, the dark is actually the blood inside.
Okay.
So where the LV stands is the blood, and here you can see
So what
it's
are we
more
seeing?
rounded.
What's when you look at that, you see what?
So here on the second shot, which is the dog with the cardiomyopathy, it is a more rounded wall, and it is a much bigger left ventricle. And the hallmark of the disease would be that the dog's heart does not contract very well. And that's really only what you can see on an echocardiogram.
And so would the dog start to struggle?
When it's more advanced, they definitely get more of the more common signs that then the veterinarian would see when they come, like coughing, respiratory distress.
Tiring out more easily.
Exactly, yes. Exercise intolerance, those kinds of things. Arrhythmias are very common as well.
Is
So
there a
it's
certain
something
age
here.
that this happens in? Is there certain breeds?
Breeds, yes. So boxer cardiomyopathy actually has its own name.
So it's so frequent. How
More
is he doing,
frequent.
by the way?
He's doing great, thank you.
Okay.
Yes. Great Danes, Dobermans.
He's very stately. Look at him.
I know. I'm very amazed. He's a good boy. Lots
He
of
is a good
training.
boy.
So there are treatments that will help, but nothing curative.
Nothing you can do to cure. If people get this, they often have to actually get a transplant later on, years and years. For dogs,
Wow.
of course, we don't live that long.
Yeah.
They don't live that long, so they usually get medications. Yes, you have antiarrhythmics, and we have some real good medications for the heart as well.
Okay.
So if I've got something that I'm suspicious of, then I need to refer them to you so you can get the echocardiogram to get a definitive diagnosis.
Absolutely. This one did requires
right.
one.
Well, it's great advice, and if you have any questions, obviously talk with your vet and perhaps have an echocardiogram. Thank you both.
Thank you very much.
Thank you, big fella. All right, now let's check in with Jay.